Before we begin, we want to do a quick little introduction about what Invisible Illness Awareness Network is. So it is a 501c3 nonprofit organization that is dedicated to raising awareness and advocacy efforts for invisible illnesses, chronic illnesses, and disabilities. And this nonprofit is also dedicated to helping students at various universities and colleges start affiliate organizations at their schools, so they can be leaders and also educate peers about different invisible illnesses, and just to create an inclusive environment to benefit patients and families affected by invisible illnesses. So what exactly is the Invisibly Aware series? So that's what we're at today. And so this is basically a setup where we hold 2 virtual meetings every month on conditions and topics related to invisible illnesses. And so the typical structure is that the first meeting of the month is dedicated to an informational presentation about the topic. And then the second meeting, which is what we're at today, is a panel essentially that includes guest speakers talking about their lived experience with one of these invisible illnesses or disabilities, or their experience treating a patient with these invisible illnesses or caring for them. So quick information about our social media. We ask if you would like to follow us. We have our Instagram and for the nonprofit, and then a separate Instagram for the Invisibly Aware series. And then our YouTube channel and our website are up there as well. And if you scan the QR code on the slide up here, you will get a link to our link tree. And we always like to say, as a disclaimer, this is not medical advice. If you are concerned about any of these issues, we ask that you please talk to your doctor. And another thing we like to mention is that no two people have the same experience with the condition. Everyone is different. Everyone experiences it uniquely. And we are not experts on these topics, but our guest speakers are experts on their personal experiences. And so we just ask you to keep that in mind. And then we like to do a quick access check here. So in terms of captions, you can turn them on at the bottom panel by clicking the CC button here on Zoom. And then if there are other accommodation needs, please message Sarah on Zoom. You can private message or in the chat, and let us know, and we'll do our best to accommodate. And then we also like to do a verbal, like visual access check. So I would go and say, I'm Prabnor. I'm a South Asian woman with black hair wearing a maroon sweater. And then anyone who is speaking can also provide a quick visual access check as well. And if at any point you have questions during our presentation, please feel free to put them in the chat. You can message Sarah once again. You can do it anonymously if that's what you prefer. And we will also make sure to answer the questions to the best of our knowledge. All right. So as we talked about earlier this month in our informational meeting, Ehlers-Danlos Syndrome is what we're going to be talking with our guest speakers today. And so we just want to do a quick review of what we discussed last time. So what is Ehlers-Danlos Syndrome? By definition, it's a group of heritable connective tissue disorders affecting the connective tissue, which is everywhere in the body. So it is wide-reaching. And its main impact is on collagen, which is the most abundant protein in connective tissue. When we think about Ehlers-Danlos Syndrome, also abbreviated as EDS, there are 13 types, and so there's separate genetic mutation for all 13 types, and they come with different symptoms and complications. And symptoms can vary, as we mentioned in the beginning. No two people have the same experience, but some common symptoms include joint hypermobility and instability, skin hyperextensibility, abnormal scarring, easy bruising, and chronic fatigue and pain. A little bit more about EDS. The prevalence varies by type. So EDS is estimated to affect about 1 in 3,000 to 5,000 people. And hypermobile EDS is the most common, the one you might have heard of. It's affecting about 320 per million people. The other types are more rare, whereas some types affect less than 1 in a million. Now, the treatment for EDS is addressing pain. So there's treatment for pain, but then there's also physical and occupational therapy, mobility aids, some supportive like treatments such as braces, splints, and surgery when it's needed. And some complications of EDS can include surgical complications that may arise from any surgeries, but also arthritis, pregnancy complications, and in vascular EDS, life-threatening risks are aneurysms and organ rupture. Okay, so now we're going to talk about hypermobility spectrum disorder, HSD, which is something we also talked about earlier this month. So this is a connective tissue disorder diagnosed when EDS is not met. And so it's a generalized, peripheral, and very localized type. It's not categorized as type of EDS, and symptoms are similar to EDS, but does not encompass all of the symptoms, so it doesn't fall under that category. It's relatively common, and the exact prevalence is unknown, but the treatment is managed very similarly to EDS. And something that's important to note is the symptoms can be just as severe and debilitating as someone with EDS. Alrighty, Morgan, do you want to take it from here?
Yes, definitely. So my name is Morgan. I am a white woman with long brown hair and a bun, and I am wearing a navy sweatshirt. So today we will have a few patient guest speakers. We have Dr. Cadet, Kori, and Sarah James. She is our co-founder and co-president, and then as well as, again, another couple patients here who have conditions of EDS and HSD. And then we do also have a clinical guest speaker today as well, and that's going to be Dr. Patel. And so she works in osteopathic. Oh, wait, Sarah, I think you wanted to introduce her. Did you want me to do that real quick? Or?
I can do it. Yes, so Dr. Patel, who works in osteopathic medicine and is actually my doctor that I go to for treatment for my HSD. She is, and I will talk more about this later, but honestly, she has been the thing that has been the best for my HSD. And yes, she's assistant professor at the Philadelphia College of Osteopathic Medicine, which is great because she is working to teach the future generation more about EDS and HSD and other comorbidities. You want to introduce yourself, Dr. Patel?
Sarah, you did a great job. Thank you. That was very flattering. Yeah, I am a DO, so I'm a doctor of osteopathic medicine. So part of our osteopathic philosophy is looking at the body as a whole, which is so important for conditions like EDS and HSD. We get a lot of patients that come through from all over Pennsylvania, even New Jersey, even up from Vermont, New York, because unfortunately there's not a lot of clinicians out there that are familiar or comfortable with either making a diagnosis of EDS or HSD or understanding what the management is. So it wasn't a condition I was very familiar with before coming to Philadelphia, but the more I've learned, the more I've been able to, work with patients like Sarah and others to kind of guide them into what's the best kind of course of action. So yeah, thank you for having me.
Yeah, thank you. Right, we will jump into our patient guest speakers now.
Hi, everyone. And then if you guys wouldn't mind taking a quick moment, just introducing yourselves.
My name is Kori. I'm a female presenting white person with brown hair that's also blonde in a ponytail, black glasses, and a black shirt. I have EDS, hypermobile EDS. I was diagnosed back in 2021, the day before my first back surgery. So I've been going at this for a little bit now, and I have learned, my ways to manage things. I've found some good practitioners, and I'm always happy to share experiences and what it's like to live like this.
Wonderful. Thank you for sharing. And then Dr. Cadet, would you mind?
Hi, everyone. My name is Dr. Akilah Cadet. I'm a stunning Black woman with hazel eyes, lots of curly hair. Pronouns are bad bitch, and for other people, it's she, her. I live in Oakland, California, and behind me you'll find a bookshelf with a whole bunch of books and things. And I'm wearing a black shirt that says "Keep Being Amazing." I'm a founder and CEO of Change Today, which is an organizational development consulting firm. Also an author of a book called White Supremacy is All Around, Notes from a Black Disabled Woman in a White World, where I actually talk about being disabled and my diagnosis journey for EDS, amongst other things, from the workplace to life. I live with myopathic Ehlers-Danlos Syndrome, so I'm one of those rare folks. Less than 1 in a million folks have what I have. So there's a lot of navigation. I just want to share that all three of my degrees are in health, including my doctorate is non-clinical, but I went to a med school for my doctorate. And so I have the intersectionality of not only having invisible and visible disability, whether I'm using braces or not, but also navigating the healthcare system and being a former administrator and provider. So I'm excited to be here.
Right, and I'm Sarah. I am one of the co-presidents and co-founders of Invisible Illness Awareness Network, along with Stephanie. I am diagnosed with hypermobility spectrum disorder and suspicion of having hypermobile EDS. I also have other things such as POTS, mast cell activation syndrome, new daily persistent headache, migraine, bunch of other stuff. I'm excited to be a guest speaker. Been a long time since I've been one.
Well, thank you guys all so much for speaking today, and thank you for introducing yourselves. I guess our first question here, so what has been your experience with Ehlers-Danlos Syndrome or Hypermobility Spectrum Disorder? So basically give us a brief overview of the things you've gone through, when you start experiencing symptoms, and kind of a description of what you experience on the day-to-day.
Oh, sorry, I jump in. I forgot to do a visual description of myself. So I am a white woman. I have a zebra shirt on, repping my zebra. I have glasses and brown hair, and my pronouns are she, her.
I guess I can get some thoughts flowing. Yeah, like I said, I was diagnosed back in 2021. I've had 2 back surgeries. I would say that's like the biggest way. And also, if you hear chaos in the background, I have a almost 5-month-old puppy, and he's got the zoomies. So he's minding his own business. But yeah, I think the biggest way that my EDS has impacted me, aside from all the comorbidities, would be chronic pain. I use a variety of mobility aids, and I'm looking into getting a wheelchair to be an ambulatory wheelchair user, just to kind of manage. But I was always told that my joints weren't coming out of place. They're like, that's impossible. That doesn't happen. And I think a lot of us hear that of like, your joints don't just like slip out of place, but they do. When you have EDS, they can. So even up until I think the last time this happened was 2022, a doctor I'd been seeing for a decade was like, your hips aren't subluxing. Like, even people with EDS can't sublux their hips. So I don't recommend doing this, but I subluxed my hip like in front of him, and he was like, oh, okay, so I guess maybe it does. Yeah, so a lot of just like dismissal from doctors, and just kind of having to learn to trust myself if something was happening with my body.
Definitely. Thank you for sharing.
I beyond frustrated for you, but congratulations, I guess. That's a way to prove a point and be petty at the same time, and I am here for it. I was diagnosed with Ehlers-Danlos Syndrome 3 years ago, but as it was shared beautifully in the introduction, Ehlers-Danlos Syndrome is a genetic condition. So I've been disabled my whole life. I just didn't know it, and that's because I was an athlete. I know if you're a woman, and I'm a cis hetero woman, we're not supposed to play sports. So my knee is supposed to go out all the time, and my ankle is supposed to, like these are the things because my hips, and it's my fault. The problem was that I stopped playing sports competitively, and I was still having, issues. And so, because of my background, I just did a whole bunch of research to find the Beighton scale. The Beighton scale, or the Beighton score, is a way to determine hypermobility, at least hypermobility spectrum disorder, or hypermobile EDS. And I like passed with flying colors. And so, because I have a primary doctor who believes me, she will tell you to this day that I diagnosed myself, and then I was able to do genetics testing, and that's how I found out that I have myopathic Ehlers-Danlos syndrome. And then I was able to have better care as a result of that. Like most of us, we have multiple comorbidities. So I wasn't lucky enough to get POTS, but I do have orthostatic hypotension. I do have MCAS. I have 17 conditions, 4 of them which are rare. And so myopathic Ehlers-Danlos syndrome is also progressive. And so it made sense that I was having more complications later in life. Right now, my hand doesn't really want to work, so I get to wear a really cool glove. But the journey for me was painful in the sense of not being believed because my stuff's presented in my heart first with EDS before it was moving into or presenting more in my joints. And so um on one hand, I was able to kind of be diagnosed in a couple years, which is early for many things. But on the other hand, I have to live in that intersectionality of being a Black person and a woman, or most notably a Black woman whose pain is generally not believed in healthcare. And so anytime I go to the emergency room, which I always have to do, my body thinks it's having a heart attack every day. I live with the symptoms of a heart attack, have a heart attack and die at any moment in time, not vascular EDS, which is part of my myopathic EDS. Um, I'm constantly not believed. I'm constantly a drug seeker, or I'm just an anxious woman. And so even though I've had a great start to getting care, it's not absent of discrimination and treatment. Oh, and I always like to say that I was diagnosed during Ehlers-Danlos Awareness Month. So that was very fitting.
Definitely fitting. I'm so sorry to hear that you went through all of that. Both of you, Kori and Dr. Cadet. That is quite the situation, and something that's pretty common, I feel, a lot across everyone on the spectrum. But I'm glad you both were able to get those diagnoses and are now able to seek some treatment and have those supportive devices. So.
And like I said, I'm currently diagnosed with hypermobility spectrum disorder, and I'm one point away from being diagnosed with hypermobile EDS, and unfortunately have not been able to get that genetic testing yet. But because of recent events in the genetic EDS world, I might honestly just wait some time and see what happens.
So
Yeah.
I would always say private labs is the way to go for genetics testing. Waiting in the system is definitely not worth it because your physician who's here can work with outside labs. I live in Oakland, California. We have so many labs here, and that's how I was able to fast track the year-plus waiting list for UC San Francisco for their hair. And I'm happy. The reason why I'm interjecting is the more you know, the better your treatment is. And anyone who's 1 point away is most likely has 80 minutes anyway, because you have Watson, and also, you have a MCAS, you have things that definitely kind of indicate stuff is going on there. It doesn't mean the pain will lessen. It doesn't mean any of that, but it just means that you can have more clarity and direction of where you're going. And you always want to rule out vascular EDS too, rule in or rule out. So that can also be treated.
Yep, definitely. Yeah, and for me, my main issues are my shoulder. I dislocated mainly in my sleep because, of course, and you wake up and like, I don't feel so good. I dislocated my shoulder in my sleep, great, and then I have to. Usually, I can get it back in myself, thankfully. Yeah.
Thank you guys for sharing. I guess we're going to touch on some questions now about what it was like to get diagnosed. So I know a lot of you touched on when you were diagnosed, but kind of about that process specifically. I know we also talked a little bit about genetic testing, but basically, like, how many doctors did it take? How long, like, from when you first started noticing the symptoms and started seeking help from when you got that officially put on your chart? And then what's the process like overall?
Yeah, for me, I didn't know anything about HSD or EDS before I went to a dysautonomia conference where they were actually doing a study about how common EDS and HSD were in POTS, or it might have been dysautonomia in general, I forget. So I signed up for the test, and I actually had Dr. Francomano do my test. If you know about EDS, she's one of the top knowledgeable docs in the EDS world. And so, because I never knew about the criteria for EDS before then. And basically she determined that I had hypermobility spectrum disorder, unofficially diagnosed me. Yeah.
I will say my journey is broken down into when symptoms started, when I started seeking help, when I got a diagnosis. And luckily for me, those last two were pretty short with each other. But I started having symptoms, I mean, prepubescent. I was, as soon as I started growing, I started having growing pain. They always call it growing pains. They always say it's normal. They always say you'll grow out of it. Um, I had cancer as an infant, unrelated. Um, but I was being kept, I was closely watched through my whole childhood. And so they sent me to see a pediatric orthopedist, who was like, well, you have scoliosis. We'll just watch that. And then it was back in like 2019, 2020 when I started really struggling, largely with my back. Um, my knee and hip stuff never went away, but I also never thought twice about it. But then it was really my POTS symptoms that started flaring up a lot that made me think like there's something here. So I got a POTS diagnosis before I got an EDS diagnosis because it was one of those things where I diagnosed myself, as some of you can maybe relate. Got that confirmed, and then as I was doing more research on POTS, I was like, wow, it's really common with this EDS. What is this? I looked into it and I was like, oh my God, it's me. So I went to one rheumatologist and she was like, what do you want? And I was like, I think I have EDS. And she goes, yeah, I think so too. And so that's how my diagnostic journey went. Thankfully, rather painless. But that's after a decade of being dismissed.
So I shared already a little bit about my journey. Again, I'll just elaborate a little bit more. My symptoms started with my heart. And so a lot of testing for my heart presented that good old tilt table test that I had orthostatic hypertension. Yes, we are all fans of that. And that was the one thing that I think really helped with me advocating for myself, with looking more into EDS. And so when I kind of put the connection together and then my doctor co-signed on me, I have what I describe in my book as a clueless moment when Cher realized she loved Josh. And I was like, oh my God. I realized that my knee dislocating playing basketball was because of EDS. It wasn't, of my hips. The one time I was just on a regular vacation, just walking around a city and ending up with a inflamed ankle or foot that was, because of EDS. And so, the bruising I had or the knee surgery I had when I played basketball and my incisions wouldn't heal, all of that was because of EDS. And so it's I don't know. It's a weird thing because it sucks to know that you have it, but it's also great to know that you have it. So it's bittersweet in a way. So you know how to advocate for yourself, but then depending on the type you have, and again, since mine is progressive, diagnosis for me was grieving the person I was. I grieve the person I am every day, and I grieve the person I become. It's not necessarily a sad thing all the time, but today is always can be the last day I do something a certain way. And so, but at least I know what's going on opposed to what's happening.
Yeah, it's interesting. A lot of people I talk to who have HSD or EDS or even POTS, they look back on their life and like, my life makes a lot of sense now that I know what's going on. Because like
Yeah, I mean, up until recently, last month, I woke up in excruciating pain crying because my shoulder partially came out and I put it back in. And I've put other joints back in, so it's not like the fear thing. But this is the one joint that had yet to come out. And I was like, it's happened. And you kind of have that moment. And so it is that for me, since I've only been disabled for 7 years, there's a time in my life where I had no idea and I lived a completely different life in the sense of like, yeah, I would, take more risks. But now I'm never going ziplining. I never went ziplining. I'm never going to go ziplining because that will be the worst thing for me to do, knowing what I know now, you know? So you're right, Sarah.
Yeah. Yeah. For me, I've been flexible, and I didn't really know what hyperextension was when I was younger. But like the thing I always refer to is, I don't know if you guys had to do like the sit and reach in gym class. I always got to the end of the sit and reach and they always thought I was cheating. I'm like, no, I'm just that flexible, I guess. Not even trying to be.
It was a scoliosis test for me because they're like, I don't think you have scoliosis, but we can't say that you don't, you know? So I was like, well, should we not look into this? But what do you know when you're 10 or 12 or whatever, you know, having the test? So
And talking about like care in terms of caregiving, my mom and I have had the conversation of like she now feels so bad that she didn't push harder when I was a kid, because we trusted the doctors wholeheartedly, especially, you know, having had cancer and there you have to trust the doctors. Like there's no choice there. So that's growing up. Like it was always trust the doctors. They know best. They're gonna fix you, because they did. They fixed me. And so now she looks back and she's like, oh, I shouldn't have just blindly believed what they were saying. I should have pushed more. I should have known. And I am always like, no, mom, no. You couldn't have known. I couldn't have known. The doctors, with as little research as there was with EDS back in the early 2000s, the doctors couldn't have even really known. But I think, yeah, that's something I think a lot of EDS parents, or parents of EDS kids think a lot is like, I should have pushed harder for answers, because clearly my kid was going through something and now we know, but how many years did they go through it without help when like maybe there could have been help?
Yeah, definitely. Especially with like a lot of these symptoms starting to present in about puberty age, especially for female presenting individuals. A lot of times it's like, oh, well, like, oh, you're going through puberty, you have your period, it's probably something related to that. And so it kind of perpetuates that cycle, especially, yeah, when you get older, it can be seen, oh, you're emotional, it's attention seeking, things like that. And that can certainly delay the diagnoses and treatment options there. So I'm sure again, some of you guys experience getting dismissed by doctors, and I have EDS as well. So that's something that I dealt with. So well, thank you so much for sharing, Rob Nor.
Yeah, thank you for those answers. It's really insightful, and I'm so sorry for the obstacles that you have faced in getting diagnoses and getting seen and validated in the medical space. Kind of going off of that, I know Dr. Cadet, you mentioned a little bit about how having the diagnosis has really informed you going forward. But we were kind of wondering how your life is different now versus before you had the condition officially or getting diagnosed. We talk a lot about the power of diagnosis, both the negatives and the positives. And so we were kind of wondering, along with what your daily symptoms are, what you experience on the day-to-day, how would you say your life has majorly changed, like before and then after the diagnosis?
I'm very expensive and I hate it. You know, in addition to Ehlers-Danlos Syndrome, I have ankylosing spondylitis, which is a rare type of arthritis in the spine. So essentially my spine wants to turn into bamboo. And so the medication for that is expensive. The medication I'm on for that is expensive. But I live in chronic pain every single moment of my life. And so a lot of it stems from my spine. And some people say the spine is important for functioning. So it stems out to lots of other things. So one day it'll affect my pelvis or my SI joints or my hips or my, my neck or, whatever is happening. So that's tough. I have a platinum PPO health insurance plan that is expensive. I am able to get care in multiple different health systems, including boutique healthcare. That is expensive. Massage is expensive. I'm a CEO of a company. I travel a lot. I cannot be in an economy seat for longer than 2 hours without my spine being in immense pain or affecting where I end up for whatever I have to do, speaking at a conference, a meeting, or navigating or moving around. And so I have to fly business in first class. I have the privilege to do that. And I understand that, but I also want to minimize my pain and suffering as much as possible. And so like Going to my friend's wedding in Italy is way more expensive than an average person for me to be present and be there. Stepping outside of my home sucks immensely because my home is the only place that is safe and supportive for me. Outside is not safe for me. Some places can be supportive, but most places, they don't see me as a disabled person because, like I said earlier, I am stunning. You can't be pretty and disabled. You also can't look healthy and disabled. You can't look young and disabled. And are you really using that cane, or is that a fashion accessory? Like, all of these things that come into play. And so it's just a lot of planning, a lot of advocacy. I have a backup TENS unit in my car. I have 2 canes in my car. I have backup medication in my car. I drive wherever I go when I could be using public transportation, but I can't rely on the stop that I'm going to go to that will have an escalator or an elevator that will work for me to go up because I don't do steps well. When I was diagnosed with Ehlers-Danlos Syndrome, I was also an escrow of my multi-level home. So I bought a home that it doesn't even work for me, on top of it. So now I'm saving money for a single-story home and then one of the most expensive markets in, America, the Bay Area. And so, it's a lot. So the way I like to explain it is, yes, expensive, but when you live with HSD or Ehlers-Danlos Syndrome or any chronic illness, chronic pain, invisible or visible, you're constantly doing math. And not 2 + 2 = 1. We're talking about theorems, things that don't make sense. So if I go to this with this person at this time, do I need to bring my butt pillow? Do I need to bring my TENS unit or my heating pad? And if I travel, but maybe something else will flare, should I bring this brace even though I haven't needed it? But as soon as I get there, will I need it? So it's so much time and energy. And prior to having diagnoses, I just lived my life in pain, but now I know what I have to do to function, to make it to the end of the day. I have an evening event tonight and I'll either have to put my neck brace on if I can't rest before I go, or I'll have to have on a TENS unit so I can keep my head up because my neck is unstable. So, that's the cost of diagnosis and the cost of having something so incredibly rare that affects everything. Not to mention your mental health, but that's probably another question.
I think go ahead. I think the way that it's impacted me the most is actually, funnily enough, within my own healthcare. I have had many a procedure done for my back, largely for my back. And I woke up from one of my back surgeries just with incredible hip pain. And I was like, this is weird. They weren't touching that. And then it dawned on me, they had probably forcefully subluxed my hip when moving me from table to table. So now anytime I have a procedure where I'm going to be sedated and moved, I do one of 2 things. If it's one of the doctors that I can trust, who knows, friendly reminder, I have EDS, please be really careful when you move me. If it's a new doctor or a doctor that I don't particularly love, I will ask to move myself onto the table before being put out. And remind that, like, the last thing out of my mouth is, please be careful when you move me. I have EDS. So being able to say things like that, and as crappy as it is, be taken seriously in that because of that diagnosis is really big for me. And it goes a long way in being able to, like, happily be sedated, because I know that there's something in my chart that says you have to treat me carefully. I've said you have to treat me carefully. I've heard the anesthesiologist say you have to treat me carefully. So if you don't, now I know that I'm not crazy. You're just, pardon my French. And it's things like that. Like, there's so much power behind a diagnosis within the medical community that when it comes to my health outside of EDS, I can feel more comfortable and confident having that EDS diagnosis, if that makes sense.
I definitely agree with what both of you said. The other thing that's mainly changed for me is my kindness to myself. Because before I didn't, like, I was in chronic pain constantly. I was like, what is going on here? But now I'm like, okay, I have this thing. I know I have to, be kind to myself, use the braces if I need to, use my wheelchair if I need to, and all of that.
Thank you so much.
Yes, thank you guys. I appreciate that. And then what type of treatments have you guys tried so far? And has anything been successful or unsuccessful? I'm sure a lot of unsuccessful things here, but at least maybe management strategies or stuff like that.
Well, I just got diagnosed with failed back surgery syndrome. So clearly those 2 back surgeries were not successful. Other than back surgeries, I've had numerous injections. I've tried pretty much every non-opioid medication on the market, including ketamine, for pain, not just for fun. I have had a peripheral nerve stimulator. I'm in the process of looking into a spinal cord stimulator. My pain management team is tapped out on what they can do. My neurosurgeon is tapped out on what he can do outside of a fusion. I have canes. I have a walker, looking into a wheelchair, because for me, PT has never really helped that much. I'm actually a rehab aide at a PT clinic, so I can take advantage of that. It also wrecks me in other ways, so there's pros and cons there. But yeah, nothing I've tried has worked. So now we are moving from the try to make it better into the how can we function with where we're at, instead of, changing the where we're at. Just, this is where we're at. What can we now do so that I can still live the life that I want to? And I love my pain management guy. If anyone's in Chicago needs a rec, let me know, because I love this man. He wants me to be able to live how I want to live in a way that's going to be fulfilling. And his question is always, what can we do so that you can get there? And are you there right now? And when I say no, he's like, all right, then what are we going to do next? So that's where we're at now. Well, we've tried everything. What do we do? What do we do next?
Yeah, I've also been down all of those roads. Pain meds didn't really help. PT has helped somewhat with my strength, but not with my pain at all. And like I said, Dr. Patel has honestly been the thing that has helped me the most, because and when I dislocate things, and I can't get them back in, thankfully she's able to get them back in as well. So that's also great.
That's always a win. Shout out to Dr. Patel for helping me out. So similar to Kori, I have lots of spinal stuff. I'm not at a surgery place yet, so I'm still early in things. So prolotherapy, PRP, is this bringing up joy for you, Kori? Trigger point injections, any type of steroid injection. My pain doc is actually trying to convince me to get a nerve stimulator for my back. And I said, I don't have the privilege to do that because I'm a Black woman who travels a lot. So I'm already stopped. I don't need to be stopped for more things. Nerve stimulator, it's an implanted device, and basically any type of traveling you do, you have to go get pat down. And I have a lot of airport trauma because people are ableist and racist. So I don't want to add anything to it. That's like a break in case of emergency scenario for me. I have a rare condition, kidney condition, so I'm actually not able to take any NSAIDs. So I can't even do an easier path for some folks, even though you can't use them all the time. And so I'm resistant to a lot of things. My heart condition makes me resistant to antidepressants. I have major depressive disorder because I have EDS. So everything is, I don't know, it's like musical chairs of figuring out what I can and cannot do for temporary release. Currently experimenting with low-dose naltrexone. Naltrexone is what's given to people who are either overdosing or recovering from opioid use. I don't know if it's doing anything because, that's just how it goes, and parts of it takes time. And then I'll be trying a new injectable sooner than later to see if I can get some relief from my back pain. But who knows how that's going to go, because I'm a baddie who likes to get all the rare side effects of things. So we'll see how that works. And I don't know, like for people who are tuning in and listening, what you're seeing is that EDS is a lot of trial and error. EDS is a lot of perseverance when you don't want to have it, in addition to constant education. So because we are actually the only experts of ourselves, like shout out to Dr. Patel. Dr. Patel's not going to know everything you know, Sarah, because you have to live with all of that. I think I have 13 or 14 doctors. I always forget. And so I'm a doc too, but I have to keep it all together while constantly educating folks around what's working for me, what's not working for me, in addition to reminding folks what EDS is. So EDS, like Kori said, is powerful to have that diagnosis on your chart, but it doesn't mean shit if people don't know what it means. They just completely overlook it. And so that's the part that is tough. The surgeries I've had to educate folks about EDS and um, catheter use and, wound healing, incisions, stitches, like a whole bunch of work. And the thing that works the best, I will say, for the things that I've tried is my cane that says MF Boss on it. But a sense of humor. And I think all of us have probably found a way to tap into humor as much as possible, to kind of laugh and smile and joke around amongst the disbelief and the pain that's a reoccurrence with EDS life and HSD life.
Thank you so much for sharing. Yeah, I know it's very, very difficult to find management and treatment and everything. So I applaud you guys for trying to figure it out and work in the system and all of that to try to see if there's anything out there that might be able to help get some relief. So I think we're
I
going to
think it's
transition to our last
really,
question.
just really quick, Morgan, it's important to note that the system is not designed for people to have EDS.
Oh,
So
definitely
for
not.
example, we are individuals, as you outlined so beautifully, that need constant forms of physical therapy throughout our lives, whether readjusting a leg, a hip, a pelvis, a back, a spine. But there's no way in healthcare to continue having consistent physical therapy without having to get a new injury or pretending you have a new injury, or you actually do have a new injury, but it's not an injury, just we woke up and the shoulder came out. So now we have to
Right.
pivot from, the core of the neck to the shoulder. And so when the system isn't designed for us, because it's not something like Kori also said beautifully, like cancer, where people have a plan and know what to do, that makes what we just all shared even more complex, because a lot of folks still don't know what to do with us, on top of not listening to us when we also know our bodies best. And so that complexity is also exhausting in itself. Physical therapists are full of ableism because they want you to heal. And can we? Kind of, but we know that it can come back again. We're doing as much proactive, preventative stuff to strengthen what we can while we can, while something else says you, and you have to realign, to get stuff together. But until that's understood with the healthcare system, we're always going to be in the situation where we're constantly spinning just to minimize. We're not even say get rid of the pain. We'll just be happy if we have some relief some of the time,
Oh, definitely. Especially, I think all of us are from the states that are speaking right now, but especially being in that type of healthcare system with the for-profit and the insurance and all the way that the claims work, it's a system that's built against people from being able to seek the access and care that they need. So.
Before we transition to Dr. Patel, we wanted to just have one final question for our patient speakers. If there was one thing you could have doctors to know, or providers in general, what is that one thing you'd want to tell them?
Listen and believe. Simple as that.
Yeah, they have to understand we have expertise too, because we have to function. We have expertise because we have multiple doctors. We have expertise because we sleep in it, we live in it, we bathe in it, we work in it, we do what we have to do in it. And it's a collaborative process. If it's not a collaborative process, then we're being talked down to and we're not being heard. They're not listening to us, and then they're not believing us. And then that is really dangerous for us because it can result in clinician associated trauma, PTSD. And so when something happens, we'll put things off and off and off because we know that the cycle is someone might not listen to us. Also, doctors should just, like, the ones you love should just not die, because that's when you have to start over again, or when they retire or something, it sucks so much.
Yeah, I definitely second that. And I would say, as we noted earlier, if you have HSD, doesn't mean your symptoms aren't as severe as EDS. They can be very similar in their severity.
Oh, thank you so much to our wonderful patient speakers tonight. You guys had a lot of very valuable input and insight. And thank you for being vulnerable and sharing your experiences and everything with everyone to learn and connect with. So thank you again. And then we are going to transition to Dr. Patel. So I think we're just changing the screen here for a second. And so our first question for you, Dr. Patel, I know we kind of covered it before, but what is your job and how does it help people who have HSD or EDS?
Sure. Before I do that, I'll do the visual introduction because I forgot to do that too. I'm a South Asian woman. My hair is in a ponytail. I'm wearing a pink shirt. So like I said before, I am in Doctor of Osteopathic Medicine, so a DO. It just means I got extra training in med school, but I have chosen after becoming a board certified pediatrician to then pursue like board certification in osteopathic manipulation. So that is a hands-on approach to patients, looking head to toe, in to out, just like a full 360 of a patient's body, and trying to find where there could be structural imbalances, whether it's tight muscles, ligamentous strains, bony issues. And then we have hands-on techniques that we can use to help kind of guide the body back to a place of healing and balance. But it also comes with I wouldn't say an expertise, but a stronger awareness of like the interplay of the musculoskeletal system with everything else in the body. So what we like to tell our students when we talk to them about EDS and HSD, especially when they come to work with us in our office, that this is like the bread and butter of the interplay of the musculoskeletal system with everything else, because it's not just you're bendy and you can do quote unquote party tricks, which I truly do not like that term, but that's how a lot of patients come to me. They're like, oh, look, I can put my leg over my head and like bend to the side. And I'm like, oh, that's great. Let me see what else you can do. But then like getting more of that history and that background to find out like what else is also associated, because that can impact the way we plan for treatment and management.
Definitely. I love the way that you guys look at everything holistically, and definitely it's more treating the patient rather than it is just treating the condition. That's one of my favorite sayings. And I think a lot of doctors sometimes forget that there's more to it than just what is written in the chart or what the test results say. So I love that. Prabnor, did you want to ask the next question or you want me to?
So one question we have is, what do you recommend EDS and HSD patients do and do not do, if you had to share?
My number one rule of thumb is if it hurts, don't do it. Now that's really hard when you live in chronic pain. But I'm a firm believer that, because of like Dr. Cadet was emphasizing before, the mental health aspect of having a chronic condition like EDS or HSD is so profound that can be almost sometimes the more debilitating thing. So I truly stand on that. If you can do it, do it. If you can't do it, don't push yourself, because we don't want to have recurrent dislocations of things, or, like with Kori having had multiple back surgeries and now seeking out other things, we're trying to keep them in as stable of an environment as possible. I like to start all my newly diagnosed patients in physical therapy because I want them to relearn how to use their body in a safe way. And we do have a pretty decent group of various physical therapists that are aware of Ehlers-Danlos and HSD and how to like mitigate that with physical therapy. So I have like very specific people, and actually like Sarah and some of my other EDS patients, I like ask them, who do you see? Because if they're working with you and you're not constantly coming back to me with injury or with pain, then they're doing something right, So that's how I've built my network, is actually from my patients. So I have like those providers that know what they're doing, but I want them to understand that this is like a life change, a lifestyle change that they have to make. I don't want it to limit what they love to do, but I want them to learn how to do those things in a smarter way, to like in a safer way, I should say.
That makes sense. That's really helpful to know. Thank you.
Yes, and I love what you said also about making sure, like, you ask your patients who it is that they're seeing, because if they're having success, I think it's wonderful to build those connections. And obviously, that could certainly help another patient experiencing similar symptoms. So our next question here, what is the most impactful moment or impactful memory that you have regarding EDS or HSD?
That's a good question. It's hard to really pinpoint that because one, like I had said in my in my introduction, I really wasn't too familiar with it, you know, and then when I came to my current job to do fellowship training, um, that's when I started hearing about it because one of my colleagues actually has HEDS, and he was telling me about it, and he's actually someone who's on like whose name pops up on the support groups and other resources, and he was getting the patients coming from all over to like make this diagnosis and like to help with like management planning and things like that. And I was just like, huh. And then I thought back to my pediatrics residency, to this one girl who was a dancer, of course, and she would like, we kept having to send her to orthopedics because she would, you know, really like sublux her kneecap and she would sprain her ankle all the time. And we just didn't know why. And it was, she never thankfully needed surgery, but it was just, she was like in and out of PT all the time. And there wasn't really an awareness of what was contributing to it. So I was like, oh, wait, I think I know what she has. Unfortunately, you know, I don't work there anymore, so I like lost that patient to contact. But for me, the other thing that has really like been impactful is listening, you know, because I see a lot of kids that have AMPS, which is amplified musculoskeletal pain syndrome, and that and EDS are very interlinked. A lot of my patients that have AMPS, I'm then diagnosing with EDS or HSD, and it's helping paint this picture as to why they're having this amplified pain picture. And as opposed to just saying, no, you need to take XYZ med, you need to, you know, just suck it up. It's like, no, you have to take these patients seriously. And for me, the primary groups of people that I see that I'm diagnosing with HEDS are children and adolescents that have been told, no, just, you know, take this pill and call it a day. You're just a kid. You can't have this kind of pain, when in reality it is. So I think that's been the more impactful thing, I would say, is just the change in, you know, that vantage point into making sure that these kids who aren't often listened to are listened to, so that that way what they're saying is real because they're experiencing it and no one else is experiencing it.
Yeah, definitely. And especially, I love the way that you said just listening, because that was, again, one of the things that our patient speakers tonight were echoing at the end there, that listening is a huge game changer for providers. So that's so wonderful that you are implementing that in your practice.
Dr. Patel, we were also wondering, in your experience, what are some common misconceptions about EDS and HSD?
That all they are bendy people and that's it. There's nothing else. They're just bendy. And bendy can just, you just don't bend, you know, you stop doing that and then you're fine. A lot of people don't understand all the comorbidities that you can have. There's more like research and stuff coming out about the autoimmune connection to EDS. There's like I said, with AMPS and EDS, MCAS, POTS, just dysautonomia in general, you know, like there's so many other things that can be just like disregarded. But sometimes those, like with Dr. Cadet and with Kori and with Sarah, like those can be the things that present first. And that can present as young as, the youngest I think I've ever diagnosed was 7 or 8 years old. And a lot of people will think, oh, they're just bendy because they're an 8-year-old. But, this little girl, she was doing circus classes and acro classes, and she would just contort her body in all these weird ways. And then she started getting back pain. And an 8-year-old with back pain shouldn't be happening. And her back pain was legitimate. I was able to like reproduce it. Her muscles were super tight. And then I was checking her joints and I was like, oh my gosh. And she was an adopted kid. So there was no family history. So it's not like we can like go through like the hereditary patterns with like that you see with HEDS. So I started her with physical therapy, which pediatric physical therapy is also very hard to find in general. I started her with that and I was like, I think for the time being, we need to back off from the circus classes because I think you're constantly straining your back. But once you get a little bit stronger, think about maybe trying it again or trying, doing dance or some other sort of creative art form, because I also did not want to stifle that part of her. And her sister happened to be one of our med students. So that's how she came to see me. And then her sister like checked in a couple years later, and she was like, she's doing so much better. She has a good control over her pain in her body. And she's been able to like do more things because she knows how to do them the right way.
I really appreciate how dedicated you are to working with your patients to really be able to continue their hobbies and their passions, because I think so often, even like in my personal experience, like there's certain things that you're advised to just stop. And I think that impact on you mentally, emotionally is way huger than we talk about. And especially in a young child, I can't even imagine. So I really appreciate hearing about that. Thank you.
And one thing I want to just say is that my practice is unique in that we get time to spend. I get 30 minutes with Sarah once every 3 to 4 weeks, how often we see each other. That's like unheard of in medicine to have that kind of time. So for that, I'm very, very grateful. I know it's a privilege for sure. But the thing is with EDS, you need time because there's so much to almost unpack at each visit that like a 15-minute visit is just a disservice. So that's part of the whole hands tied situation with healthcare, because healthcare has become such a more corporate entity than it used to be like 20, 30, 40 years ago when it was like a mom and pop, like you can call your pediatrician on a Saturday and they'll open the doors for you to go get seen, insurance, like that was already hinted at. I play that game for PT. I'm like, okay, let's see what's new. I like have all the old prescriptions scanned in my chart for each of my patients. I'm like, okay, I already used that code. Let me use this code this time so I can get more sessions covered. I don't want patients to pay for anything out of pocket if they don't have to, because it is an expensive game. So yeah, so it is a luxury, I will say, the time I get, but I guess that's also why we see so many people with these like complex conditions, because we have that time to spend with them in our office. And I say we because it's not just me. There's 6 other docs in my group, and we all will see and diagnose HEDS and HSD and help manage it. So
That's wonderful that there's so many of you guys that, especially because it's such an untapped market, for lack of a better word. There's hardly any providers that are able to specialize and treat these conditions. So just one last question here. What do you want patients, other medical professionals, and the general public to know about EDS and HSD?
Like I said before, it's not just, I can't help but think if anyone watches The Real Housewives of Beverly Hills, one of the women on there, Kyle Richards, she has said that she has like a connective tissue disorder, and one of her party tricks was always going into the splits and things. And I like keep going back to that because that's like the glorified image of connective tissue disorders and hypermobility, as opposed to the real life, which is Kori and Sarah and Dr. Cadet. You know, that's real life. Those are the patients that you need to be seeing and need to be highlighted. You know, so just that kind, just like understanding that it's not just, oh, you can do these fun, goofy things and call it a day. It's like, no, I can do these fun, goofy things, but then I can't move for a week, you know? So I think I just want more people to understand that it's truly a disability. It's truly something that needs special attention. Like Kori was saying with the surgeons, you know, whenever I've had my EDS patients that need surgeries, like I have one that needed a appendectomy, like an emergent appendectomy. And when she told me, you know, that she had the surgery, I was like, oh my gosh, I was like, what kind of sutures did they use? Like, what were your incisions like? And it took a really long time. And we did a lot of work to like help with the wound healing and stuff. And then she had to get some varicose veins taken care of, and her recovery was, so she had to wear her compressive device for a lot longer than someone else would. And I'm just like, do all these physicians know what your diagnoses are? And they're like, yeah, but they just do the same thing that they would for everyone else. And I'm like, but that's not. And luckily she has a very good, you know, she's not super complex. She doesn't have a lot of comorbidities. So even though it took time for her to heal, we were able to get through it, and she has been able to heal pretty much fully. But other patients would not be able to. So I guess it's just like self-education, you know, if a patient like, and listening, if a patient says, oh, I have this as a diagnosis, it's not just a code on your computer screen. It's like a legitimate lifestyle affecting condition. So understanding that.
That's wonderful. Yes, and we appreciate providers like you. Thank you so much for coming to speak tonight. You have been incredibly informative, and thank you for again sharing your experiences on what it's like to treat patients with these conditions. So,
of course, and thanks to you guys. I've told Sarah this and Win, because I see Win a lot too, that this is such an amazing organization bringing light to these conditions that walk around every day and you're not seeing it, you know, or understanding it. So kudos to you guys as well.
thank you.
Yeah, we can open the floor to questions as I'm getting the presentation back up. But if anyone has any questions at all, please feel free to type them in the chat or raise your hand, and we can call on you and you can speak, or message Sarah anonymously if that's something that you want to do. But yeah, now's the time for questions, and we'll get everything back up. And this is for both Dr. Patel or any of the guest speakers that spoke previously. So Sarah, Dr. Cadet, Kori, anyone, even I have HSD as well, so I'm open for anything. I know Morgan mentioned that she has EDS, so any questions at all, please feel free to ask.
I will say I'm an open book with anything, so feel free to ask away.
And while we give everyone a moment to think of questions, just some quick announcements for next month. So in September, we're going to be covering chronic pain conditions, specifically fibromyalgia, complex regional pain syndrome, and trigeminal neuralgia and occipital neuralgia. So our first meeting of the month will be on September 11th at 8:00 p.m. Eastern Standard Time on the same Zoom link you're on now. And we'll be going over the general background of all these different conditions in our presentation format. And then on September 25th, we'll be having a similar meeting to what we're having right now, a guest speaker meeting on the same Zoom link, where we have guest speakers talk about their experiences with those conditions. So we hope to see you there. But yeah, any questions, any comments and things? Thank you so much for everyone sharing your time and expertise on your own individual conditions or your specialty with us today. We really appreciate your time and your willingness to be open and vulnerable and talk about your experiences. It's really valuable information. I know we're going to have some people be watching this on YouTube when we upload it who couldn't make it today, and it's just, thank you so much. It takes a lot to just deal with everything that we all deal with. And we really do appreciate you being willing to share that experience with others to help educate other people and bring awareness to these conditions overall.
Just say anyone who's listening or anyone here, if they ever want to reach out for commiseration or celebration, feel free to slide in my DMs. I know that my information was shared here. I do, particularly after Dr. Patel's wonderful, really we need more doctors like you. So thank you, Dr. Patel, for your presentation. Um, taking a lot of people forget, along with your own patient advocacy, to take the time to build a relationship with your doctors. The ones who believe you will give you more time. The ones who believe you will find time for you, whether it's through email or a follow-up appointment or putting 15 minutes together. I'm the favorite of all my doctors. That's something I'm very proud of because I set expectations, I value them, and they value me in return. And so I get a better response rate. People know how to look out for me. It's not fair, but it's the way in which we can work in the system. And the problem with EDS is that the doctors who don't have patients to, look for the zebra, right? As we are called, they're the ones who aren't good doctors. So fire doctors, find another doctor, definitely do that. But the ones who are taking the time to find the zebra, they will give you more time because it takes more time for the things that are rare. So please realize the power of that relationship building to get more of what you need and what you deserve.
Just wanted to echo, thank you so much to everyone.
Yeah, thank you so much. And I'll briefly share our slide again for if you would like to follow us on Instagram, our ad is invisible_illness_network. And we share posts multiple times per week on different conditions or awareness months or awareness days, and also information on our Invisibly Aware series about different presentations that we're hosting and different meetings and who to expect to see at them. We'd be happy to see you there. And our link tree also has our website and all of the fun stuff with our YouTube and whatnot. So thank you so much for taking the time out to come to this meeting today. And thank you to all of our guest speakers again for sharing all of that they've shared. And we really appreciate your time coming out here. But yeah, if there's any questions at all, please speak up.
Thank you so much. Keeping amazing, everyone.